my name is Amber. I'll be your nurse today. May I have your name? Okay, may I have your date of birth? Okay, great. Today I will be changing your wound dressing, taking the old one off, putting a new one on. Do you have any questions about that? No? Do you have any pain? No? If they did or needed or assigned, I would administer that 30 minutes before the procedure. Okay, then. Let's get started here. Let me just provide some privacy. Okay. And we're just going to position you up a little bit towards me, okay? Let's do that. Just put your arm up for me. Put that a little bit under your back so you're tilted towards me. Okay. All right, good job. Yeah, we're just going to open this up a little. I'm going to keep it covered. Privacy there. All right. Alrighty. I see the wound. Okay. Try to keep you covered there. Okay, let me just perform hand hygiene and put on a clean pair of gloves. Okay. Alrighty. I'm just going to loosen the edges and just gonna pull the tape, but push your skin the other way. That way it doesn't rip your skin. That side's loose, so it's not. Okay, we don't have any signs of drainage. If there was, we would note it at this time, or an odor, or a smell and color, and the amount. Okay, we have our trash right there. We're going to assess the wound. The wound looks good. Looks like it's healing well. Granulation going on. It's red. No signs of infection or any pus or anything. I'm just going to palpate around the wound, okay? We're just going to palpate for bogginess. Okay. No signs of bogginess. We are going to now measure. I'm going to measure the length of the wound. Make it as close as can be, but we don't want to touch it. Make sure we don't touch it. It's 5 inches long by 1 inch wide. Okay. And in order to do the depth, we have open a sterile swab here. Just going to put it in the deepest part. I don't want to push. Put my fingers right above the skin without touching them. And then you can use your measurer. We have a 1/2 inch. Okay. We'll drop that in there. Okay. Very good. We will now prepare to clean it. Okay. Alrighty. I will take these off. And I will perform hand hygiene. And I will come over to my sterile field here. And I will try to pick up from the bottom as I can of my sterile dressing here. Don't want to try not to touch the edges much. And you want to pull it, open it away from you. And around the back there. Okay. That is going to be for our saline. So we are going to put that right there. Okay. And this is, pick up right here. We have an inch border. This will be our sterile field here. I don't want to touch anything with it. I'm just going to turn it around here just by touching the edges and make sure I do not touch anything. Okay. All right. That would be our sterile field. And then we shall pick this up. Try not to touch the edges and come over to the side and kind of just let it jerk out there to the middle, pump out there. And we're gonna keep this because this is where we're gonna put some saline in there. Again, you don't want to touch the edges. 1 inch border. We will now get our saline. It is a new bottle. Expiration is good. So we will put some saline into here. Okay, if it wasn't new, we would lip it, so it would be good. Okay, now we are going to do our sterile gloves. You want to pick them up by the edge. Okay, you want to open it away from you. Nice. And then you can just kind of grab the edge there. Pull them out. Okay, and that will go right in the basket. And we will just touch in the edges of here now, just the edges. And we want to open those sterile gloves. Make sure you can see me here. We're going to open the top first, just touching the edges. You want to open the top away, and then the sides. You just want to touch the outside though. And you can open them up. Okay. And now we're first going to pick up on the inside, our first one. And you just only want to touch the inside. And make sure you don't touch the outside, and that keeps it sterile. And on the next one, you actually touch the outside of the glove. I gotta get it underneath it. And then you can get your hand in there, because that one's on the outside there. Okay. Okay. Now, I should have done this before, but I will. Oh no, I'm going to put my dressing, wound dressings in there. So they'll be all set. You kind of want to open them up a little bit. Oh, that's my second one. Open them up. There we go. Okay. Maintain a sterile field and get everything ready. We're now going to clean the wound. We're going to take our new pack. You have your 1-inch border. You don't want to go out of your 1-inch border of your swab sticks, your simulated swab sticks. This is to clean the wound. And you like to open them. You don't have to open them all the way. You have 3. And then so what we're going to do is we're going to take one. And first you're going to go a little right down the middle. Clean to dirty, top to bottom. And you want to twist it back and forth. And then we shall drop it right there in the basket. We're going to do the right side, and we're going to not touch the outside, but back and forth and back and forth. And we're going to twist it on one side. And we're going to pretend that didn't come out of there. And the last one, the left side, twist back and forth, back and forth. Okay, there we go, top to bottom. We can dispose of that. And now we need to prepare our dressing. With our non-dominant hand, we can pick up our dressing, our gloves with the saline. And that wet hand, because it's wet, is now considered clean. It is not sterile anymore. These are sterile. So, just going to use these to open this up. That way. Okay. And remember, you don't want to touch anything. That hand is clean. It is not sterile. Okay. I like to bunch it up there so we get an easy start. All right. You don't want to touch the edges. I don't want to bunch it up in there. I call them little ruffles. Okay. And once again, so this clean. We will get the other one. Squeeze out the saline. And we shall open that up so we can apply the dressing. You want to kind of get it, so you get to open it up a little bit. Okay, and we shall start where we left off. Do not want to touch the inside, the outside of the skin, nor do you want to touch with the tongs any of the skin. Okay, and that last one there. Okay, now I shall just put those in the trash. I will, with my clean hand, I will take the clothes pads and cover that. This hand is contaminated, and I was going to finish, and this is the ABD pad. We'll put that with the blue line up. We are going to cover that up. Okay, and then we are going to tape it, and we shall tape the edges. Okay, we shall do this edge first. And then once it's covered, pretty good. And out of that tape, kind of measure. Okay. And you just want to make sure you don't put any pressure on the wound if you need to press the tape down there. You also don't want to lose the tape. Okay. Much. Alrighty. There. Good. And that one right there. Okay. Good. I am now going to pick this up. That is not in the video because I don't know why it came out of my swabs. So we are going to pretend that did not happen. I am going to clean up my dirty film. I'm going to dispose of everything. I'm going to take off my sterile gloves into the trash. Okay, I'm going to perform hand hygiene. And then I am going to come over here and get my pen, and this is when we would fill out a tag with the date, time, and my initials, and we will place it on to the wound so they know when it's been changed. And now we will get our patient back to privacy. Cover them up. And we shall take that pillow back out there. Are you comfortable? Okay, bed's at lowest position, core light. Once again, the little thing that came out of the swab, so don't know what that was. An extra piece of the swab. And I went to touch my glove paper for covering the wound. Other than that, patient is all set. Thank you.